Hello,
Exactly.
how are you?
I'm good.
I was telling them how we used to test for low sperm counts, cancer, everything, name it. We used to do all the testing for any disease. So I was talking about salt in the mud before you came in. And Dr. Orji, I don't know if you remember those days. It was fun before we went back to school. Guys, don't mind me. I always tell you guys I play too much. Welcome, my love. Good to have you here. Thank you for being here. Oh, Dr. Orji is in the house. That's what Casey said. Thank you for being here, Casey. You've always been a regular. Every single weekend I see you here, I do appreciate you. I don't take it for granted, okay? And guys, if I don't mention your name, it's not on purpose. So if you want me to shout you out, you can put a comment again so your name will come back up, okay? So it's not on purpose. Don't take it personal. I love you all. Chi-best, Messi, thank you for being here. Thank you, thank you, thank you. Love you all, love you all. Thank you all for being here. So Dr. Orji is here. Dr. Orji, looking beautiful as ever, loving the lip color. So anyway, we're not going to make this all medical because I posted a picture we took some time ago. I took it with Dr. Orji and Dr. Adu, and I captioned it, not your regular docs. We don't like being boring. People expect doctors to look boring, act boring, no life. So, but anyway, that's why I'm saying what I'm saying. Yeah, Dr. Orji is here. So we're going to kick off the breast cancer awareness that we want to create. Like I said, before some of you came in, Dr. Orji is a surgeon. She has performed many breast cancer surgery. She's taken out breast cancer from people's breasts. She's done other surgeries as well. So I brought her here so she can be able to give insight in breast surgery and give people opportunity to ask questions from a doctor that is trained in the United States and have massive experience, know what she's doing, okay? So I've actually had somebody back home that went to the doctor and they were trying to do surgery on her. And they told her she had breast cancer. She called me and I told her to not do it, not do anything, instead to go get a mammogram. She was actually like, what is a mammogram? This is part of why I started this health thing, because I saw a gross ignorance.
Mismanagement and ignorance. Well, it goes both ways.
Mismanagement, ignorance of medical issues with our people. So when I told her to go get that mammogram, eventually she found way to get a mammogram. It turns out she doesn't have breast cancer. It turns out it was milk ducts, because after you have a child, your milk eventually can begin to congeal and cause you to have lumps in your breast. And that can be mistaken for breast cancer. So after that, I've always had this feeling me that there's need for awareness, and I feel frustrated sometimes because I don't know how to create this awareness. I don't know how to tell people. How many people am I going to tell? So that's why I thank God for this platform where I can finally be able to tell people, hey, this is how you can be healthy. This is what you need to do in my own little capacity. Okay, that's all I can do. So Dr. Orji is here. Type your questions in the comment section if you have any question about breast cancer or diagnosis, what to do, how to do it. And Dr. Orji, in the process where we're waiting for people to ask questions, you can give us an overview. I actually wrote down a few questions for you. So let me see if I can get it. You can give us an overview about how can individuals reduce their risk of developing breast cancer. Let's do that first, okay? Before we go into anything else. How can they reduce their risk? When I say
it's important
when I say reduce their risk, I mean how will you not get breast cancer? The easiest way not to reduce your chance of getting breast cancer. So Dr. Orji, over to you.
Well, first of all, breast cancer, the reason why we're talking about it today is because breast cancer is one of the leading cause of cancer death in women worldwide, not just in America, not just worldwide. It's one of the most frequently diagnosed cancer in women. And it's only second, at least in developed countries, it's only second to lung cancer in terms of leading cause of death. The reason why it's no longer the leading cause of death is because of some of the advances that's happened over the past decade, research.
Dr. Orji, sorry to cut you off. Adjust your camera so we can see your face.
You can't see my face.
Dr. Orji, can you hear me?
Yeah, I can hear you. Can you
adjust your camera so we can see your face? Move your camera up a little bit so we can see your whole face.
Does that help?
Yeah,
Is
go
that
ahead.
better?
Mm-hmm.
Okay. Can you hear me though?
I can hear you, yeah.
Okay. So breast cancer And so the reason why it's important for us to talk about this today and continue to create awareness is because of that, because it's, most frequently diagnosed cancer in women and only second leading cause of death in women. It also affects men, a little less commonly, very rare in men, but still accounts for about less than 1% of all new cancers in men. So
Dr. Orji, you're sideways. Your camera is sideways. Or is it just missing? Dr. Orji, you're sideways. Okay, go ahead. Go ahead. You're good. You're good. Go ahead. It's okay now. I think it's just my phone.
Is this better?
Yeah. Yeah. And speak a little louder so we can hear you. Yes. Okay. It's perfect.
So how do you reduce your risk? Well, as a woman, we know that 1 in 8 women will be diagnosed with breast cancer during their lifetime. So there are multiple things that you can control, some you cannot control. If you have a family history of breast cancer, that adds up to your risk that you cannot control. However, there are risks that you can control. We know those things that are generally associated, not necessarily as a cause, but associated with cancer in general. So some of them being, of course, smoking, but specifically some of the things that's been associated with breast cancer: obesity, nulliparity, which is not having a child at all, or having a child much later in life, just because of the exposure, of the prolonged exposure to estrogen. Of course, age, gender are the things that we can't change, right? Age, gender, family history of breast cancer itself. People that have a family history of breast cancer are 4 times higher than the general population. And then another one is family history of ovarian cancer. People that have the genetic test and the gene, BRCA1 or 2. Having a male relative that actually had breast cancer is much more significant, and therefore will increase your risk even more. Other type of this, being of certain descent, like people of Ashkenazi Jewish descent are well known to have a much higher risk. Other genetic mutation, and like I said, the modifiable risk will be things like late age. Kind of semi-modifiable risk is late age at your first pregnancy, not having a child at all. Early, one of the things that increases your risk is early, what we call early menarche, which is the age at which you had your first period, and then late menopause. So as much as some people may prefer a late menopause, so for example, you're still having your period, maybe not the period part, but not having hot flashes and all those things well into your 50s, could be considered a late menopause. So that's also increased risk, because then that means you're being exposed to estrogen a lot higher. Hormone replacement, the length of exposure to it. Now, of course, we talk about combination hormone replacement therapy and doing specific selective replacement and only what is needed. Lifestyle, we talk about, obesity, we talk about dietary intake. Important for you to include grains, fruits, and vegetables, low fat diet, and specifically low saturated fat in your diet, low calories in your diet. Avoiding alcohol can be protective. What else? Environmental, like we talked about, smoking, eating certain food, the charred food, processed food, things that have carcinogens in them have been also associated with increased risk of cancer in general. And that's not any different from breast cancer. So there are also numerous factors that people have talked about. It's been speculated, suspected, but not proven. And I'm not here to talk about those, because if it's not proven, yes, if you suspect it, think it's one of the things causing you, feel free to avoid it. But if it's not proven, I can't tell you that it causes cancer. So that's one of those. You can't hear me?
Okay, I can hear you now.
Okay. So that's essentially how one can reduce their individual risk of developing breast cancer. And of course, if one does develop it, one of the things, of course, we're talking about is ways to reduce those risks, but then early screening. That's why we talk about screening, what age of screening, who should be screened. It's so that if one does get it, you catch it at an early age. That makes a big difference. I think the amount of survival that we've seen has to do with early detection, because we are creating awareness. There's research going into it. And so when you catch it early, you are more likely to be cured of it, and therefore less women are going to be dying of breast cancer.
Okay. I was just going to talk about... We can't hear you again.
You can't hear me?
Okay, we can hear you now.
Okay.
Okay, guys, I need you all to please converse in the chat section. Can you guys hear Dr. Orji? Because sometimes it looks like I'm not hearing her, so I don't know if it's just me. Can you type in the chat section? Let us know what is going on, okay? If you cannot hear, say something. If you can hear, that's okay. Okay, we kind of, like I said, we need to interact with one another. Let's make it interactive. Okay, Bonita, I can see you. Thank you for being here. Ngozi, you are welcome. Okay, somebody wrote they can hear. So, Dr. Orji, I don't mean to cut you off. Continue talking. It's just that maybe it's just me, but sometimes I don't hear you. But somebody just wrote that they can hear you. So continue. I think I was going to ask you about that detection process. If you can walk us through just somebody that is a layman, somebody, Ehi, you're welcome. Thank you for being here. Okay. Somebody that is a layman, let's say a person that doesn't know, and please don't use big words because we want everybody to be able to understand what we're talking about. Like when you say carcinogens, when she says carcinogens are simply things that can cause cancer or have been associated with increased risk of developing cancer. So, Dr. Orji, stay away from big words, please. But anyway, what I was going to ask you, to a normal person, a layman that doesn't know anything, like all these ladies or gentlemen that are watching this, some of them have not thought about breast cancer before. What can they start doing from now on? What is maybe just one routine or maybe just one thing they can start doing to reduce their risk of developing cancer? Even including in terms of detection, is he checking their breast, how often? And then, just give us an overview of being on top of your health in terms of preventing breast cancer.
Okay. So when we talk about breast cancer, it's important to know that early breast cancer can be completely asymptomatic, meaning no symptoms whatsoever, right? That's how come we can see someone today and they say they're fine, and then tomorrow, oh, they're diagnosed with cancer, and people are like, I just saw her yesterday, she was fine. Well, yeah, she's still fine today. It's just that she has breast cancer. And so it can be completely asymptomatic, meaning no symptoms. And so what can you do to begin to look? That's why we have screening, right? This is why we have screening for breast cancer, because we know that most breast cancers have been there before even you can see it on mammogram. And mammogram can detect the earliest forms of cancer before we can even feel it, meaning the patients or we as clinicians. Before we can actually feel the breast cancer on exam, mammogram can detect it earlier than that. And so that's why we do the screening. It's still important for people but who is eligible for screening? So let's talk about it. Of course, in general, we say women 40 years and older for the general population should start breast cancer screening, and that includes mammogram. So screening mammogram is now advanced. We have 3D mammography, we have computer-aided mammography that allows for good detection. So screening mammogram for the general population, that starts at 40. And the recommendation from American Breast Surgeon is really every year. You will hear about going, every other year and stuff like that. But again, just be sure to understand that that is all about money, all about how we can save money by spacing it out, not necessarily about your risk. So, but ideally, we recommend yearly mammogram, screening mammogram starting at age 40. And that's for the general population. If you have a family history of breast cancer, that's a little different for you. So if you have a family history, especially a first-degree relative that was diagnosed with cancer, then it may be that you may have to start your own screening a lot earlier. So what does that mean? So for example, if your family member was diagnosed with breast cancer at age 40, well, your screening should not start at 40. Your screening should start at least 10 years before that person was diagnosed. So when a patient comes to me and they say, oh yeah, my mother had cancer, the next follow-up question is, oh, what age was she diagnosed? If that person is deceased, the family member is quick to tell you, oh, they died at this age. That's fine, but I will not fine, but I really want to know what age were they diagnosed. Because if they were diagnosed at 40, but God forbid, maybe died at 50, it's important for you to know which number to go with. It's the 40 years old that you need to go with. So if the family member was diagnosed at 40, then your screening should start at 30. So why is it that we don't recommend breast cancer screening for 30s and 20-year-old? Because at that age, the breast is very dense. And therefore, the likelihood of missing stuff in mammogram increases. So for dense breast, we start to look for other modalities to begin to get real good sensitivity when it comes to detecting breast cancer. So if, for example, that person whose family member was diagnosed at 40 now has to start at 30, they may start with screening mammography at 30. Now, if after that screening, the radiologist says, oh, that person has a dense breast tissue, and they will always put it like a fine print right at the bottom of the thing that says, you know, people with dense breast tissue, you can miss, some lesions can be missed. Then those people, they may recommend that you get additional imaging, such as MRI. MRI is really gaining weight and just gaining momentum because MRI combined with breast exam and ultrasound, as well as mammography, really has a very, very high sensitivity to detecting invasive cancer. And so breast cancer screening for general population starts at 40. If you have a family member that was diagnosed, you want to start 10 years before that family member was diagnosed. And then in addition to that, it's evaluation. So it used to be a push for breast self-exam. And if you read some literature, it will say that, you know, breast self-exam is no longer recommended. Instead, we are pushing more for breast awareness. So not a series of just, you know, doing your own breast exam, but really getting to know your breast as a woman. And that starts at a much younger age. So even before you are old enough to get a mammogram, our young girls should be checking their breasts, knowing what's normal for them and what's not normal for them. That way they can be the best advocate for themselves, right? Because even when something changes, they are going to be in that position to say, I've been checking myself, know my breast, and this is new. And therefore they can go to their doctor and stand up to that doctor and say, hey, something is new. The doctor may, oh, you're not old enough to get a mammogram. I know, but this is new. For how many years now I've been looking at my breast and this is different. And therefore that doctor will now, you know, be forced to really attend to you, not ignore you, not say, oh, you don't know what you're talking about, or give you that false reassurance, because it can be false reassurance when you're told, oh, you're not even 4 yet, you're not old enough to get a mammogram, it's probably fine. You don't want to hear it's probably fine. You want to hear it's fine. So you want to know that you know. So in those cases, that's when you're able to go and advocate for yourself, and maybe in that case, get an ultrasound, get a mammogram, yes, early, but and do that and go from there. So evaluation includes your being aware of your own breast, early screening of starting mammography early. If you do feel a mass, because a lot of people do that where they feel something and then they run to go to their doctor and say, oh, I think it's time for me to get a mammogram. And then they call the doctor and the doctor sends them for a screening mammogram. That is the wrong test. When you feel something in your breast, you are no longer going for a screening mammogram. You need to be going for a diagnostic mammogram. And that's a little bit different and very important, because a diagnostic mammogram will almost always follow an ultrasound. So then you are able to really know what is going on in the breast. So if you feel something, then you now need to get diagnostic mammogram along with ultrasound sonogram, another word for that, of the breast.
Thank you so much, Dr. Orji. Thank you, Ebele. Thank you for being here. My one and only namesake, Raphael. Thank you for always being here. I heard you guys. I heard you guys plenty. Thank you all so much. Please hit the like button, like this video, share it, because these are information that people pay a lot for. Please, before I continue, let me hail the one and only Ijele, Lolo Ijele Nwai. Lolo Ijele Nwai is in the building. Okay, and I'm sure many of us know who she is. So Lolo, you are so welcome. Thank you for being here. We appreciate you. Lolo, you always ask me a lot of questions. So type it in the comment section now. We have Dr. Orji, who is an expert in breast cancer and have performed many breast cancer surgeries. We have her here. Guys, ask her your questions free of charge. If you go to see her, you will be paying like $500 just to see this woman, okay? Just to see her in her office. $500. I know what I'm talking about.
Don't tell people that.
And she's here. That's not true. So ask her your questions. And then I just saw Lolo Odimegu. Wow, we have all the Lolos in the house. Lolo Odimegu, you are so welcome. Ndidi, you're welcome. Thank you all for being here. And Ijele said, that's my two wonderful doctors in the house. Yes, much love. We love you too, Ijele. Thank you all for being here. And then I saw a question that I wanted to mention. Somebody asked if you add, okay, I'll go back to the questions. If you do treat breast cancer with chemotherapy, radiotherapy, can it completely go away? That's the first question. And the other one, somebody also asked that they had men do get breast cancer. I've said it here many times. Men get breast cancer. Many men have been diagnosed with breast cancer. Okay, so that one for sure. Men do get breast cancer. That's why sometimes our people, our wonderful people, we love our people. Okay, hence we're here. We're still thinking of our people. Our heart is at home. I love my people. Ignorance is killing us, unfortunately. A lot of people will pass and they will say that they ate at their uncle's yesterday and that's what happened. A lot of all this passing may have nothing to do with the uncle that gave you cola, gave you it's things like this that you don't even know exist. You may feel a little lump in your breast. You're like, oh, it's nothing. Maybe I need to rest. So anyway, so yes, the answer is yes, men do get breast cancer. A lot of men have been diagnosed with breast cancer. Then in terms of, can the breast be totally cured? Can it go away with chemotherapy and radiotherapy? That's another question. Dr. Orji, I will let you answer that because you're the expert.
So if we get into, as we get into treatments of breast cancer, how do we treat breast cancer? Well, breast cancer can be treated as, again, it goes back to the importance of catching it early, right? Because it makes a difference what stage you were diagnosed in, right? A stage 1, or even what we call a DCIS, breast cancer that has not left the membrane, is still, we know for sure it hasn't even broken the membrane, it's not even an invasive cancer yet, can be cured by surgical lumpectomy, meaning you just take out the cancer with a little bit of margin, negative margin around it, and make sure that nodes are negative, and then followed by radiation to the breast without any chemotherapy, to all the way to needing chemotherapy before surgery, needing radiation, and then chemotherapy after surgery. So this is why it makes a big difference what stage you were diagnosed. This is why we're pushing for early detection, screening, because if you are diagnosed at stage 1 or early 2, it is totally curable, and sometimes without chemotherapy, depending on what type of cancer you have. So the type of cancer is important because there is a big difference between somebody who has a DCIS and someone who has an invasive cancer. There is a big difference between having a ductal carcinoma to having inflammatory breast cancer. There's a big difference to having hormone-sensitive breast cancer, meaning you have estrogen receptors are positive, progesterone is positive, HER2 is positive, versus having all those 3 hormones being negative. We call that the triple negative breast cancer. There is a big difference. How those are treated, very different, right? And so it's important. Yes, cancers can be cured, especially when you get it at an early age. Some later stage cancer have been cured, put into remission. We calculate what we call disease-free survival, right? Time that the patient did not have the disease for how many years, those that came back, those that, and stuff like that, the different ways to look at it. But the higher the stage, the more likely all those numbers are going to.
Can you guys hear Dr. Orji? Dr. Orji, I think your internet may be acting up. Okay, guys, till we can get her back, let's continue. Again, please, I want to keep mentioning, don't forget to like this live, okay? Go ahead and hit that like button, the little thumbs up, and share it. Share it because a lot of people need to hear this information. Yes, a lot of people need to hear this information, okay? Go ahead and share it. Share this video, share it, share it, share it. This, like I said, if you were to go see Dr. Orji, you'll be paying, honestly, no cap. I'm not lying. I know what people pay to see her, and she's here free of charge. So bring your questions. Go ahead and ask, and she'll be able to answer you. Chinelo Mwadike, thank you for being here. I appreciate you always. Comfort, thank you for being here. Chinelo is asking, I think Dr. Orji's internet may be having a little glitch, but let's continue. Hopefully she will come back. Chinelo is asking how and when a woman is supposed to be checking her breast. Is it daily, weekly, or monthly? Dr. Orji, can you hear me? Dr. Orji, can you hear me? You can hear me? Onyi, you're welcome. You're welcome. Thank you for being here. I just saw Onyi here. Okay, hold on. Hang on, guys. We're trying to get Dr. Orji back. I told you guys, I don't know if you all are praying with me, that the enemy is always after these lives, especially when we're dropping some real important information so people can stay ignorant. But we're not going to let it. So this internet, you need to obey my voice. You will work. So we're trying to get Dr. Orji back. I think she's having a little bit of a glitch. Dr. Orji, can you hear me? Dr. Orji, can you hear me? Okay, guys, so while we wait for her to come back, let's continue. Okay, so when she comes back, we will ask the questions we had. Doctor,
Okay,
are you back?
I am back. I was
Okay.
always here. So can you hear me?
Okay, I can hear you now. I couldn't hear you before.
Okay, great.
Yes. So somebody was asking, let me see if I can read it again. How and when a woman is supposed to be checking her breast? Is it on daily, weekly, or monthly?
Again, because
And
that is no breast self-exam is no longer a recommendation. Remember what I said earlier, it's breast
mhm.
awareness. Just choose when and how you want to do it
So
and do
tell
it. The
them the
goal
difference.
is to know your breast. The
Doctor, you
goal,
tell them the difference between breast self-awareness and breast check. Tell them the difference. So they will understand what they're supposed to be doing.
what you're supposed to be doing is knowing your breast. Your breast is yours. It's going to be different from my breast. It's
How
going
do
to
you know
be
your breast?
by checking it, by
So the same checking,
looking at
right?
yourself. So it's not breast self-exam per se.
Mm-hmm.
It's
Mm-hmm.
really, so to me, it's like words. We're just playing with words. It really is, because the goal is look at yourself in the mirror, get to know your breast. You see it, you see the way the two breasts are. Some people will say that, there's always one that is different from the other. One is bigger, one is smaller. Get to know that for yourself. Get to know how your nipples and your areola, which is the darker area around your nipples, usually is, right? If it's always get to know that. Some people are actually born. I have some patients that have natural inverted nipples, right? If that patient wasn't able to advocate for herself or say something, once I see an inverted nipple, I'm scared. I'm thinking that's cancer, because that's one of the things that we can see as cancer progresses, is that the nipple can invert in retracted nipples. But it's good for this patient to know, oh, since I grew breasts, my nipple have always been this way. So if you are one of those people, it's important for you to know that. As opposed to one day somebody's now telling you, oh, this is seen with cancer, then all of a sudden you start thinking, oh, I have cancer. Meanwhile, this nipple have always been like this for the past 20 years. So it's important for you to know that. Know how your nipple lies. Know the feel of your breast. So yes, I always say that the best time to do that is not right before your period, because some of us have tender breasts or changes in our breasts that happens hormonally, because of hormones, right before our period. And so that may not be the best time to do it. But it's really every day. If you think about it, you shower every day, you look at yourself every day. Some of us look at ourselves in the mirror every day, right? You see yourself. Well, when you come out of the
Some of us,
shower, don't
you mean like 10 times a day?
exactly. When you come out of the shower, or when you're in the shower, there's nothing wrong with looking at it, one, and
Mhm.
then feeling it, making sure that, hey, it feels the same. And
Mhm.
over time, you don't need an extensive exam to
Mhm.
know your breast. And
Mhm.
therefore, when something is not right, you don't need, you don't wait for it to be extensively bad before you
Mhm.
feel it. And I say this because I have people who are very alert. I have patients who are very alert, and
Mhm.
every little thing they want to check. I never fault those people, because I would rather you be alert and aware, and
Mhm.
all I have to do is reassure you. But those patients are not going to miss a thing or allow a little marble sized mass to become a grapefruit. Then on
Mhm.
the other hand, you have people that have a marble sized knot, and they're like, yeah, it's probably nothing, even though that didn't used to be there. And they let that grow and it becomes a plump. And they're like, oh, it's probably, they find every reason to say, oh, it's my deodorant, or it's anything. And these are legitimate reasons that people have given me. And you're like, really? We laugh about it now, but it's not. Because the truth is that sometimes there are two kinds of people. There are those that are very pessimistic, and there are those that are, always see the glass, half full. So sometimes if you're the glass half full person, you may make excuses for things you have no business making excuses for. If a plum is in your breast or under your arm, and you say, oh, well, it's probably my deodorant. It's probably not,
Mhm.
you know. So go have it checked out. And it's not just breast, it's about everything. If you cannot explain why you're having pain, if you cannot explain why something is there, go have it checked out. And yes, it sounds like I'm advocating to go to your doctor, but you probably should, because they studied the body. You didn't. However, you know your own body, because every one of us will be a little bit different. So it's important for you to know what's different for you. So when we speak about breast awareness, that's what I am talking about. So whether you look at your breast every day, feel it once a week, really feel it really good once a month, it's up to you. But the goal is to continue to check it, continue to look at it. If there's any lesion on your skin, because some people have, normal skin lesion, keep an eye on that. You may have a mole on your skin. It's normal to have a mole. But if your mole is beginning to change, it's beginning to get darker, it's beginning to get irregular in the margins, something's not right. If your nipples, and you're not breastfeeding, but all of a sudden you're having a nipple discharge, go check it out. You are right. If you're breastfeeding, yeah, that comes with it. But if you're breastfeeding, the milk should look like milk. It shouldn't be bloody. So if you're
Mm-hmm.
breastfeeding and the discharge is now bloody, you should go check it out, or else that child beat you in the nipples and is bleeding.
Mm-hmm. Mm-hmm.
So,
Okay. Okay.
you can't hear me?
Yeah, I can hear you now again. I don't know why you keep coming in and out. Mm. So, guys, can you guys hear Dr. Orji? I need your cooperation in the chat section. Can you guys hear her? Type in the chat section if you're hearing her. Let me know if it's just me. I don't think they can hear you. Okay, guys. Dr. Orji, can you hear me?
I can hear you.
Okay,
Can
we
you
can
hear
hear
me?
you again. Okay, we can hear you now. So another question is, I think you've answered the question about how often to check. Chinelo, I hope you got what Dr. Orji is trying to say. And for the sake of everybody, what Dr. Orji is trying to say, before, it used to be recommended that you do a self-breast exam, maybe once a month, where you actually check for lumps in your breast. But Dr. Orji is telling us that now, that is no longer recommended. However, what is recommended is that you check your breast. Lord, I can see you. Let me know when you're ready to come up, because your mouth looks like you want to talk. And Lola Jeremiah, two. Let's have the two Lolas in the house, in the building. But anyway, so what Dr. Orji is saying is that instead of doing a weekly or a monthly self-exam, that what is recommended now is you know your breast. You are still checking, but not like a formal checking, but that you get to know your breast. That means it's a continuous thing. It's something you're doing constantly. You're constantly looking at your breast. You're constantly feeling on them. Yes, feel your breast, check on them, look at them, get to know them. Get to know them as if you're going on a date with them, as if you're cutting your breast. Yes, date your breast, cut your breast, marry your breast. So you get to know them very well. So if anything changes, you will be able to know that something has changed, and you can go to your doctor and say, check this out, because this is not normal, because everybody is different. Okay, what may look normal to you might be abnormal for somebody else. So the cocoa of the matter is that you get to know your breast, so you will know when something is different. That includes lumps. That includes, because I think I'm understanding why that recommendation is changing. Before, they say just check for lumps. But what Dr. Orji is making us understand, science changes every day. Science is continuously changing. That's why I love science. Continuously studying new things, because it's no longer just about lumps. It can be about change in color. It can be about discharge in your nipples. So if you're not breastfeeding a child and something is coming out of your nipple, haba, you need to get it checked out, because which kind of milk is that? So it could be cancer. So that's what Dr. Orji is saying. It's no longer about just checking for lumps. It's about knowing your breast, marrying your breast. So when they change, when they begin to cheat on you, you will know. When there's a discharge, when there's a... When I tell you guys I play too much, I'm even hiding my play side from this social media. When there's a change in color, when there is a bruise, something that may look like a bruise, you think, oh, it's a bruise. It may not be a bruise. It may be a sign for something serious. So I hope we answered the question for Chinelo, and for everybody else watching. That is how you check your breast, okay? And then even Oni said information is power. Your mammogram is important. But the reason I'm not pushing on mammogram is because I know where we come from. Some people may not have access to things like mammogram. So I try to put that into consideration. If you can get a mammogram, please get a mammogram every single year, at least, especially if you're 40 years old. If you're younger, you can get it if somebody in your family have been diagnosed with breast cancer. Okay, but if you don't have access to mammogram, all hope is not lost. It doesn't mean you will get breast cancer. You need to know your breast. So when something changes, you can now seek out help and get it checked. Okay, is a comment that Casey made here that I like. I mean, I wanted to ask Casey, are you in the medical field? Casey said, take note if there's pain in your breast or anything, excretion from your nipple, unusual swelling, and even abnormal lumps. So all these are what you're checking for. So when something changes, you will know. Law jelly why? The only law on social media. Lolo says, Dr. Orji, one question, but don't laugh. Oh, anytime my late husband finished sucking my breast, hey, it don't happen. It has happened. Sharing a question with the answer. Okay, Dr. Orji, are you listening? He said, anytime my late husband finished sucking my breast, the breast will start paining me. Because what is the cause? I always get mammogram once a year, and the result is always good. So what is the cause of the pain? I think I have an idea. I have an idea, but I'm going to let Dr. Orji handle it. But I think I know why your breast is hurting.
It could be just manipulation, because there's a lot of things. So every pain, and one of the things is very important for us to know here is that, again, I hit it so many times because it's important. Most breast cancers are asymptomatic, meaning there is no symptom. There is no pain. There is nothing, right? Because people will say, well, I don't have pain, so it can't be cancer. Actually, false. Actually, I'm most likely to think it's cancer if there's no pain. So very important for people to understand that when breast cancer starts to hurt, it's not when you first get diagnosed. It's not when the lump first appears. It's actually much later when it's advancing, right? So most of the time, there will be no pain. Now, when you have an axillary lymph nodes, meaning a lump in your armpit, sometimes it may hurt. But most of the time when it first appears, it doesn't hurt. So most pain in your breast could be from trauma. Whether that trauma is from pleasure, it's still trauma. Or whether that trauma is from you walking into the door and jamming your breast into the door, trauma is trauma, right? It's from a controlled, pleasurable trauma, but it's still trauma. So it could be from that. And usually that goes away, right? And it doesn't persist, okay? So right now that he hasn't sucked it in a while, it shouldn't be hurting now, Angela, is it?
It's not. So, Doc, you answered it perfectly, but you're answering it like a doctor. We can't hear her again. What is this?
You can hear me?
Okay, I can hear you now. I think it may just be my own mic. Okay, I think I can hear you now. I think Doc answered it like a doc. In plain terms, your husband was sucking too hard.
Don't be accusing the man
was enjoying himself. So, Ijele, no wahala. After he finished sucking, just rub some Vaseline and move on with your life. Let the man live his best life. So that's what is happening. Then somebody else asked. Anyway, Nkechi said, Lolo Dimegu has to talk. Lolo Dimegu, people are requesting for you. I don't know if you're still here, but if you're here, Nkechi particularly is requesting for you. Lolo Dimegu, your fans don't plenty. Okay, now back to question. Somebody asked, is there a benefit? I'm looking for the question again. What is the health benefit of a man sucking his wife's breast?
I don't know. There is no health benefit that is documented and known any more than you breastfeeding a child. So, yeah. Some people may say maybe when he's around there, he's more likely to find something.
Okay, let me bring Lord Dimegu up. Lord Dimegu is requesting to come up.
Because I have found that a good amount of patients where it's actually the husband that found the lump. So that may be the advantage, is that someone else is also looking at the breast or feeling the breast and understands the breast. So that may be from that standpoint. But no, people that do have cancer do not have cancer because their husbands did not suck their breast. So it's very important for me to say that, because especially in our people, that's been speculated and been talked about. So yeah.
Okay. Thank you so much, Dr. Orji. I think you guys have woken up Ebubedike, the national lord. Ebubedike says, I learned that your husband will always be the first person to detect any lump. So your husband should be sucking your breast every day.
Right there, we can do breast exam.
Let your husband feel and touch your breast on the daily basis. Avoid the story that touch. In as much as this is funny, Lolo, you're welcome. In as much as this is funny, it's true. It goes with getting to know your breast, marrying your breast. If your husband is very familiar with your breast, they will also be able to tell when something changes. So I guess the advantage is indirect. So the person asking, I think is Ame, the person asking the advantage is when you suck it every day, know it every day, it will be easier for you to know when something changes. Because in life, people are just going, busy. Everybody's busy. They don't sit back to know what is happening. But now, when you're something that you do every day, when something changes, the wife may not even know. You, the husband, will be able to know. So that is an advantage. So it's an indirect advantage. And another advantage is that it brings connection between you and your wife. So there's a lot of advantages of you sucking your wife's breast. It breeds connection. Okay, it's just like when you're suckling a child. That child know you forever. That child trusts you. That child love you. That child, you do anything for that child. It's the same thing. It builds some kind of special connection. So women, I beg, let the man suck, and don't hold it.
And that's great. So now let me speak for those that are not married. For those that are not married, continue to do your breast awareness. Because again, on those days that he's not going to suck it, on those days that whatever, get to know your breast. The reason why some of those people is someone else that figured out what is going on in their breast also has to do with the same exact thing that we're talking about, that they are trying to be ignorant. And I say trying because I'm not going to say anybody's ignorant. To ignore your own self and not see and not feel what is going on in your body. For someone else to feel it means that it's palpable. And if it's palpable, you can also feel it. So it goes in line with the fact that you are not aware and checking on your own self. And so, yes, having two people, meaning in addition to your husband, but again, we have to be an advocate for all because there may be people here who are not married. Their life is not doomed because they're not married.
I think they understand. I think they understand that we're not saying they're at a disadvantage. I think the people that are married,
I'm just saying,
I think they understand that. They're not at a disadvantage.
Whether so that breast awareness is from you and your husband or just you alone, the key is breast awareness.
Exactly. So you can do it, you and your husband can do it. Either way, the bottom line is get to know the breast. Whoever needs to know the breast, just don't let another man outside know the breast or another woman outside know the breast. As long as it's within you and your spouse, I beg, love each other, get to know the breast very well. And if you're not married, you will be getting to know by yourself till you're married. Then after you're married, you and your hubby will start getting to know. But the key word here is there will be a knowing. Okay? I hope we settle that. And Lord Dimegu, let me welcome you to this live. You're looking beautiful as always. And people have been requesting you, Lolo. You're disappointing your fans, so they waited for too long. So all the people that are requesting for Lolo, here she is. And I think at this point, if anybody have another question about breast cancer, please quickly write it in the chat so we can move on, because somebody requested that we talk about Regina Daniels. And at this point, Regina Daniels is trending. We all know what is going on. And somebody actually asked me, can I postpone the breast cancer awareness next week so we can talk about Regina Daniels today? And I said, no, sweetheart, we will combine it. We'll get the breast awareness. The only thing we may have to stay a little bit longer, but we'll get the breast awareness thing out of the way, then we can talk about Regina Daniels. So if we still have a question for Dr. Orji, this is a time to ask. Otherwise, we will move to Regina Daniels. We are all still going to learn, because while we speak to Regina Daniels, is a lot of lessons to learn from it. You know, initially I didn't used to do all this celebrity news, but somebody brought it to my attention and said, you don't know, you by your opinion and the way you analyze it, people can still learn. So it's still a teachable moment. And you can use other people's mistakes or other people's happenings, because it's not necessarily a mistake or a bad thing, but things that's happening in other people's life to teach other people so they can avoid it. You don't have to wait till you make the same mistake or reinvent the wheel before you can learn. So that makes sense. And I think that's how come I started talking about, you know, the things that is happening in the news or happening with all these our celebrities. So do anybody, before I go, my own husband, my own auntie almost beat me last week, said I didn't shout her out. And so auntie, please, I hope you have forgiven me. My knees are on the floor. If I kneel down now, I won't be in camera again. Otherwise, I'll get up and kneel down. So auntie is my husband's sister. And auntie is, auntie is my bestie, and my auntie, I know the place my auntie. Auntie, I don't... Auntie will be like, you're overdoing it now. Auntie, welcome. Don't mind me. Auntie Ogo, welcome. Good to see you here, okay? Donald Ofyong, you are so welcome. Good to have you here. Thank you so much. A lot of people are laughing. I don't know. I guess National Lord and his movement for men to suck breast. I think National Lord eventually will start, because we start a foundation on men sucking breast, a foundation for men to suck. So you guys are so welcome. Again, if I don't mention your name, forgive me. It's because I didn't see it, because it goes by so fast. And don't forget to like this live. Please hit the like button. Please hit that like button. That's the only thing I ask. Hit the like button for me and share it. oh no, I'm asking for something else. Share it. Share this live so many people can see it. So we actually be able to do what it's supposed to do, which is help other people to learn these things that we are learning here. Can somebody ask, can husband sucking the breast have any effect? Dr. Orji, Dr. Orji already said that it doesn't have any special effect.
I think the effect is the fact that more people are,
except that the husband will get to know your breast and be able to know when something changes. Correct, Dr. Orji? Yeah. Okay, so moving on to Regina Daniels. We have all seen what is going on in the media.
Before you move on to Regina Daniels, I think there was a question. Good afternoon, Dr. Orji. Good afternoon, everybody. Good morning, good evening, depending on your time and where you're watching from. I remain Lolo Dumegu, but Fortune Aguzakwele on Facebook. So somebody asked, could the cancer spread from the breast to other side of the body?
Yes. So when we talk about early detection, that's the whole point, right? Because if it's not detected early and it's in stage 2B, the 2B, 3, 4, then it spreads to other parts of the body. So the first place that the cancer in the breast is going to spread to most likely is what we call the sentinel lymph node. It doesn't always follow that, but that's why we look for it. So it is the node in the armpit on that side of the breast. So if it's on the left breast, we expect it to be on the left armpit. If it's on the right breast, it will be in the right armpit. There's also what we call other nodes that are along the chest walls, nodes that are along the neck. And so we look at it. So it's in the lymph node first, and from the lymph node, it can travel to other parts of the body. That's what we call distant metastasis. So once you have regional versus distant metastasis, then we're talking about higher stages like stage 4. Stage 3 could be an advanced cancer, meaning locally advanced, meaning a huge mass that based on its size alone, it's in a higher stage. And then others could be smaller mass, but it's also in a lymph node. And so that is why when you get the mammogram, they look at your armpit as well, the axillary area, looking for any palpable. On exam, we look for it on exam when we examine you. If you come in and you have a breast lump and there's also a lump in your axilla, that's not a good sign because that means that lymph nodes clinically already looks positive. And then also if you have an advanced tumor or even any, not early stage, but 2 and higher, we tend to do what we call metastatic workup to make sure it hasn't gone anywhere else, right? You may get a CT of your chest, abdomen, and pelvis. You may even get a CT of your brain. For example, if it's an older lady and the family member is also saying, well, she's kind of acting somehow, you need to make sure that it's not in the brain. So common things, if you look at it, breast being sitting right there on your chest, it could go to your bones, it could go to your lungs, it could go to the brain and other places, liver, distant metastasis. If it's just in the axilla with just a regional lymph node, it's not a 4, but once it's anywhere else, it's a stage 4. And so the higher the stage, the more it's going to take to actually put it in remission or at least give the patient a disease-free survival. But definitely the higher stages and also the triple negative cancer will require more of the traditional chemotherapy, more than just the hormonal therapy that we have. So if a patient has breast cancer that is positive for estrogen and progesterone receptor, it's actually good because then they are going to be amenable to the selective estrogen receptor modulators that we have. And if they are postmenopausal, then of course we can use things like aromatase inhibitor. And this is not only, we can start it on the patients, but even after their breast cancer is cured, we continue it for about another 5 years, and it's a pill. So it's like a chemotherapy drug that is a pill. So much easier to tolerate compared to traditional chemotherapy. And then we keep them on it for 5 years. So it also helps reduce their risk of cancer subsequently.
Okay. So thank you so much, Dr. Orji. In essence, I guess what Dr. Orji is saying is that yes, okay, it can spread to every other area. Okay?
And that's what kills.
Yes, it can spread to other areas, and that is what kills. So the sooner you capture it, the more it's contained in that small area, and it can easily be taken out. But the more it spreads, the more difficult it is to get under control. Okay, basically. So are we good on breast cancer? Anything else, or do we move on to Regina Daniels?